Then this video talks about the Quadratus lumborum and Iliopsoas, as well as some hip range of motion. And I couldn't help myself. I had to also do something with the cruise ship. But the reason that I'm spending some time with this much video on the Quadratus lumborum and Iliopsoas is one, because these muscles and the Iliopsoas in particular can mimic orthopedic issues with the knee. I mean, it can result in significant lameness in the hind legs, sometimes even non-weight bearing lameness. And you may be suspicious then of a cruciate problem when actually it's an iliopsoas problem. But also to point out the relationship of these two muscles, and how the quadratus lumborum is a little more on the lateral aspect of the lumbar area, but it does attach into the ventral ilium. But the iliopsoas, it attaches to the lumbar, some of the vertebral body and transverse processes. So it really is a ventrally oriented muscle. And so you have to gently get up in there. With me, I'll show you how I use my fingers to really feel what's going on there. But if you think about its origin and insertion and its major role, I mean, it is a hip flexor, but its major role is to control hip extension. When you have iliopsoas problems, hip extension will typically be limited in their gait. And so they'll have a shortened stride when they're standing. When they're walking, when they're standing, they'll often put their hind leg that's involved, their affected side, a little more cranial. It will be positioned to just put that muscle and tendon on a slack. And they'll be less interested in like jumping when there's going to be rapid hip extension that's needed, and also can be associated with some back pain. So let's just visit these muscles. And then for the quadratus lumborum, it attaches here along the iliac crest, the ventral aspect, and comes up along the ribs. You can kind of feel its edge right here. And it does share some fibers with the iliopsoas,